Everybody, Rebecca here. I just wanted to take some time to answer some questions that I've gotten since my first video posts. First of all, just to let my family know, this is not an update on the pregnancy, nothing to report. I go to the doctor next Wednesday at 4:30 for a maternal serum alpha fetal protein test. It's blood work. To look at the neural tube something, I don't know, make sure there's no indications for anything to worry about. If those results come back good, then we won't do the amnio. If anything arises from the results, then we'll do the amnio the following week. So we'll let you'll know how those turn out. And I just want to thank everybody for all the subscriptions. Wow, I guess it pays knowing people, AJ. And thank you for your comments, your congratulations, and your encouragement. We really appreciate that. And I'll just go into answering some questions. The first question that I got was from another young lady that was also 14 weeks pregnant. And she wanted to know if I experienced gas. So, and just to let you know real quick, this video is not going to be a pretty one. I'm going to talk about gas and menstruations and monthly cycles and stuff like that. So it's not for the faint of heart or the weak stomachs. So just be forewarned. So she didn't say that if she was also post-op. So I'll answer questions from both sides of the fence there. To put it simply, yes. But without embarrassing myself too much, I was a gassy person before my surgery, before I was pregnant, so but more so since I've been pregnant. And as I understand it, that is a common symptom of pregnancy. I have noticed that gas and bloating for me is worse when I partake in a lot of dairy products and of course gas-inducing foods, beans and broccoli and stuff like that. So it's just one of those things where they're almost necessary evils, especially for someone post-op, where those beans are high in protein and low in fat. It's one of those things I just have to do. So I do, but then I try to also watch the cheese contents and stuff like that of my other foods. So, but they're not usually. It's not usually too bad. One full day of bubble guts, as one of my friends called it, every couple of weeks, I guess, maybe. So it's not so bad. All right. Then another person asked about if I experienced hair loss after surgery. And the answer is yes. However, since I was diagnosed with PCOS, hair loss is a symptom. So I had that even before surgery. It was more pronounced after surgery, but she wants to know what I did to rectify it. I was religious with my protein shakes and getting my protein in my meals first. And then I guess about 6 or 7 months after surgery, when it really didn't taper off when I expected it to, I started using biotin. That's biotin. It's a supplement for hair and nails. So my skin was really dry too, and that's normal because we're fighting to get our 64 plus fluid ounces in a day. So our skin and hair is affected too. So I did see an improvement with that. Now, was it because of the biotin or was it because I was getting farther away from surgery? I can't say, but my hair still falls out. But luckily I have thick hair and it's not noticeable. I don't know if it's a normal amount for most people or abnormal or more or less, so it is what it is, as what a wise man once said. So I wish I had a more definitive answer for you. The same lady also wanted to know about fatigue and weakness after surgery, if I experienced it, and the answer is yes. I had read before the surgery to expect it for, a good 6 weeks after surgery. So I didn't keep track of it, but it was around 6 weeks when I started to get my energy back. And to rectify that, you just stay hydrated, you keep up on your protein. I was fortunate enough to be able to be out of work for 4 weeks, so I was able to take naps regularly in the beginning, and then at work I had a sit-down job, so that was also helpful. But it did come back, and then some, because you're losing weight, you're eating healthier, so you just feel better. And lastly, she wanted to know how many calories do I eat in a day. I don't tell you. I mean, I can't tell you. I don't count my calories. It would drive me crazy. I did that all before, and one of the reasons I had the surgery so I didn't have to do it again. But I just make healthy choices, low fat when it's available. Now there are some things that I just don't do low fat on, like cheese. I don't believe in low fat cheese. I do like part skim mozzarella, but if I'm doing cheese, I'm having full fat cheese. But I don't need as much of it because the flavor is stronger than the low fat. Plus, when you start getting into low fat and no fats, they have all those preservatives, and you got the flip side of things that aren't good for you. So I don't eat anything deep fried or just high in fat content, period. I do my lean proteins first, then my vegetables, and then my carbs. So I figure if I keep in mind to have those 5 or 6 small meals a day that are based around those things, then I'll get a good amount of calories in that will sustain me and help me lose weight. So again, I wish I had a definitive answer for you. That wasn't something that was really pushed at our surgeon's office. They just told you to eat well and worry about the calories later. There are people who count calories, so if it works for you, better good for you. Then another young lady asked about my menstrual cycles. This is where, it's kind of embarrassing, but I'm out here to try to help people. So she wants to know if I see any significant difference in my cycle after my surgery. And the answer is yes. I guess it was about 5 or 6 months after surgery, so that was between, say, 80 and 100 pounds lost. I was on birth control to begin with anyways. I had been for years just to regulate my cycles. But my doctor wanted us, anybody of childbearing age, to practice safe sex and have protection. So I was on the pill anyways, but I started noticing that my cycles became lighter, whereas I would have to wait for that 7th day to take my pill and to see some decrease in the flow. I started seeing a lighter flow altogether and then fewer days. And then I actually felt what my doctor believes was probably when I started ovulating. I felt it down in my lower region. And I was also just cranky, really irritable, and didn't know why along about the 6-7 month period. And he said it's probably when my hormones started to balance back out and I started ovulating. So and then obviously it worked for me after that, or at least the one time. We'll see how the rest goes, but I'm getting right on the pill right after the baby's born, so because we don't want any more, at least not so quick. But I think that was all the questions that people had asked me. I really appreciate you all asking me questions so that I can start making videos and get some answers out there and try to start helping people. So I encourage you, if you have any more questions, please let me know. All right, I'll take